Did you know that 1 in every 3 people may develop cancer at some point in their lives? The sad truth is that many cancer cases are discovered at a late stage, and this is a major disaster because people often miss the early warning signs. According to experts, detecting cancer early, specifically in stage 1, can dramatically increase the chances of recovery by up to 90% for many types of cancer. However, if it's discovered in the late stages, particularly stage 4, the survival rate drops to less than 20%, which is very low. That's why in today's episode, I'll be sharing with you the most important early warning signs of cancer. These are simple signs that could serve as a life-saving alert for you or even help save someone else's life. Please watch carefully. This episode is extremely important because it covers small changes in the body that may appear before the problem becomes serious. Many people overlook them, but identifying them early can make a huge difference. Now let's talk about the key warning signs that have been scientifically proven to help detect cancer early, when treatment is most effective. First, persistent heartburn. This is a common issue often related to spicy food or heavy meals, but when heartburn lasts for weeks or even months, it may be a sign of esophageal cancer. This can result from chronic acid reflux, which over time damages the lining of the esophagus, a condition known as Barrett's esophagus, which is linked to a higher risk of cancer. It's important to distinguish between occasional heartburn and chronic reflux that doesn't improve with medication or lifestyle changes. Never ignore this condition, especially if it comes with difficulty swallowing, a sensation of food being stuck in the throat, or unexplained weight loss. The solution? If your symptoms persist or don't respond to treatment, consult your doctor immediately. They may recommend tests like an endoscopy to check for changes or damage in the esophagus. Remember, early detection is key. Second, night sweats without a clear cause. Most people may experience this occasionally, but if the sweating is excessive and happens regularly, especially at night, it may be a sign of lymphoma, a type of cancer that affects the lymphatic system. It's often accompanied by fever, unexplained weight loss, and extreme fatigue. The reason? It's the immune system reacting to the presence of cancer cells, which disrupts the body's temperature regulation. The solution? Don't ignore these symptoms or assume they're just due to stress or anxiety. It's important to consult a doctor, even if it turns out not to be cancer, as they may point to other issues like infections or hormonal imbalances. Early detection could save your life. Third, jaundice, yellowing of the skin and eyes. Jaundice is a condition in which the skin and the whites of the eyes turn yellow. It's usually caused by a buildup of bilirubin, a substance produced when red blood cells break down. The liver normally processes bilirubin, but if there's a blockage in the bile ducts, as seen in cases of pancreatic or liver cancer, it begins to accumulate in the body. Jaundice often comes with other symptoms such as dark urine, pale stools, and pain in the upper abdomen. If you notice these signs, don't delay, consult your doctor immediately. Early detection is the only way to increase your chances of survival. Make sure to watch the full episode to learn about the rest of the warning signs, because your life and the lives of your loved ones could depend on noticing these subtle changes. There's also something extremely important to understand. These signs may be an indication that the body isn't eliminating waste and toxins properly, which is why they need urgent attention. Now, jaundice doesn't always mean cancer. It could be caused by gallstones, liver infections, or other conditions. But if it appears suddenly and without a clear reason, it's crucial to see a doctor right away. Ignoring jaundice may delay diagnosis, and in some cases, that delay can be life-threatening. Pancreatic and liver cancers are often diagnosed in their late stages, which is why we always say early diagnosis is the key. It improves treatment outcomes and helps identify and address the underlying cause. Fourth, persistent bone pain. If you're experiencing deep bone pain that gets worse over time, especially at night, and doesn't respond to regular painkillers, it could be a warning sign. This is particularly concerning if the pain is coming from the bone itself rather than the surrounding muscles. Bone and joint pain should never be ignored. In some cases, it may be caused by bone cancer, such as osteosarcoma, or by cancer that has spread from another part of the body to the bones. If the pain is accompanied by swelling, unexplained fractures, or other unusual symptoms, it's not something to brush off as just aging or minor injuries. It could be a serious warning sign. The solution? If the pain continues, gets worse, or is accompanied by swelling or other symptoms, see your doctor immediately. Early detection here can make a huge difference. Fifth, unusual skin rashes. Many people assume that rashes are simply allergic reactions to something they ate or touched. But did you know that some types of rashes can be serious indicators of diseases like leukemia? A specific type called petechiae appears as small red or purple spots on the skin that don't fade when you press on them, unlike regular rashes. These occur due to a low platelet count, which causes blood to leak from small vessels under the skin. If you notice this type of rash, especially if it's accompanied by unexplained bruising or bleeding, take it seriously. Leukemia affects the body's ability to produce healthy blood cells. The solution? If the rash persists, or you're experiencing other symptoms such as fatigue, frequent infections, or excessive bleeding, consult a doctor immediately. Even if it's not leukemia, catching these signs early could make all the difference. Sixth, persistent fever. Without a clear cause. Fever is usually a sign that the body is fighting an infection, and that's perfectly normal. But if a fever lasts for a long time without a clear reason, it could be an early warning sign of blood cancers like lymphoma or leukemia. This kind of fever is often intermittent. It comes and goes, and doesn't respond to common treatments like antibiotics. It may also be accompanied by other symptoms, such as night sweats, unexplained weight loss, and general fatigue. Why does this happen? It's the immune system responding to cancer cells, triggering an internal alarm system in the form of persistent fever. The solution? If the fever lasts more than 2 weeks, or if it keeps coming back without a known cause, don't ignore it. See a doctor immediately. Don't assume it's just a simple infection. Early detection here could not only explain the cause, it could save your life. Seventh, changes in the nails. Changes in your nails may seem minor or harmless, but they can sometimes be early indicators of serious health problems, like subungual melanoma, a rare form of skin cancer that develops under the nail. One of the most notable warning signs is a dark vertical stripe under the nail. It may look like a bruise, but unlike a normal bruise, it doesn't fade over time. It grows along with the nail. Another key sign is known as Hutchinson's sign, pigmentation that spreads from under the nail onto the surrounding skin. You might wonder, could it just be a fungal infection or a simple injury? The difference is that melanoma often appears suddenly and continues to grow or change over time. The solution? If you notice a new stripe on your nail, or if an existing stripe is becoming darker or wider, do not ignore it. It's important to see a dermatologist as soon as possible. Early detection is crucial, especially because melanoma can be extremely dangerous if left untreated. Eighth, eye pain. Eye pain might not be the first thing you associate with cancer symptoms, but there's a rare type of cancer called ocular melanoma, which affects the pigment-producing cells inside the eye. Although it's rare, detecting it early is extremely important. Some of the key symptoms include blurred vision that doesn't improve with new glasses, flashing lights or sensations similar to migraines, a dark spot on the iris that may grow or change in color or shape over time. The good news? Regular eye exams can help detect this cancer before symptoms even appear. So if you notice any of the signs above, don't delay. Visit an eye specialist. These symptoms could also signal other serious conditions like retinal detachment or glaucoma, which also require urgent diagnosis and treatment. In the end, paying attention to these warning signs and acting quickly could save your life. If you notice any of the symptoms we discussed in this episode, don't ignore them. See a doctor right away. Early detection leads to better outcomes and gives you a real chance at timely treatment. Your health is worth the care. I wish you all a healthy life, free from illness and worry. And if you found this episode helpful, don't forget to hit the like button and share it with your loved ones. Someone you know might need this information. If you have any questions or thoughts about today's topic, drop them in the comments. I'll be more than happy to respond.